Hi there! We're going to discuss about intravenous pyelogram or IVP related to venipuncture. For the speakers, we have Zarina to discuss about the preparation and performing IVP and its equipment. Corinne to discuss the procedure, work, and perform. We have Eileen to discuss about the experience during and after the procedure and who interprets the result. Jade Ann to discuss about the benefits versus risk, limitations of IVP exams and why it is done. And yours truly will discuss the IVP and some of its common procedures. Intravenous pyelogram or IVP. In medicine, venipuncture is the process of obtaining intravenous access for the purpose of intravenous therapy or obtaining a sample of venous blood. It is also one of the most routinely performed invasive procedures and is carried out to obtain blood diagnostic purposes or to monitor levels of blood components. Blood analysis is one of the most important diagnostic tools available in clinicians within healthcare. Its data is relied upon in the clinical setting for interpretation of myriad of clinical signs and symptoms, and developing skills in venipuncture can facilitate holistic and timely treatment. An intravenous pyelogram or IVP is an X-ray examination of the kidneys, ureters, and urinary bladder that uses iodinated contrast material injected into veins. An X-ray is a non-invasive medical test that helps physicians diagnose and treat medical conditions. Imaging with X-rays involve exposing a part of the body to a small dose of ionizing radiation to produce pictures of the inside of the body. X-rays are the oldest and most frequently used form of medical imaging. When a contrast material is injected into a vein in the patient's arm, it travels through the bloodstream and collects in the kidneys and urinary tract, turning these areas bright white on the X-ray images. In IVP, allows the radiologist to view and assess the anatomy and function of the kidneys, ureters, and the bladder. Common uses of the procedure. An intravenous pyelogram examination helps the physician assess abnormalities in the urine system, as well as how quickly and efficiently the patient's system is able to handle fluid waste. The exam is used to help diagnose symptoms such as blood in the urine or pain in the side or lower back. The IVP exam can enable the radiologist to detect problems within the urinary tract resulting from kidney stones, enlarged prostate, tumors in the kidney, ureters, or urinary bladder, surgery on the urinary tract.
How should you prepare? Your doctor will give you detailed instructions on how to prepare it for your IVP study. You will likely be instructed not to eat or drink after midnight on the night before your exam. You may also be asked to take a mild laxative in either pill or liquid form the evening before the procedure. You should inform your physician of any medication you are taking and if you have any allergies, especially to a barium or iodinated contrast materials. Also inform your doctor about present illnesses or other medical conditions. You may be asked to remove some or all of your clothes and to wear a gown during the exam. You may also ask to remove jewelry, dentures, eyeglasses, and any metal objects or clothing that might interfere with X-ray images. Women should always inform their physician and X-ray technologist if there is any possibility that they are pregnant. Many imaging tests are not performed during pregnancy so as not to expose the fetus to radiation. If an X-ray is necessary, precautions will be taken to minimize the radiation exposure to the baby. What does the equipment look like? The equipment typically used for this examination consists of a radiographic table, an X-ray tube, and a television-like monitor that is located in the examining room or in a nearby room. When used for viewing images in real time, called fluoroscopy, the image intensifier, which converts X-rays into a video image, is suspended over a table in which the patient lies. When used for taking still pictures, the image is captured either electronically or in film.
How does the procedure work? X-rays are a form of radiation like light or radio waves. X-rays pass through most objects, including the body. Once it is carefully aimed at the part of the body being examined, an X-ray machine produces a small burst of radiation that passes through the body, recording an image on photographic film or a special digital image recording plate. In an IVP exam, an iodine-containing contrast material is injected through a vein in the arm. The contrast material then collects in the kidneys, ureters, and bladder, sharply defining their appearance in bright white on the X-ray images. X-ray images are maintained as hard film copy, much like a photographic negative, or more likely as a digital image that is stored electronically. These stored images are easily accessible and are sometimes compared to current X-ray images for diagnosis and disease management. As the contrast material is processed by the kidneys, a series of images is taken to determine the actual size of the kidneys and to capture the urinary tract in action as it begins to empty. The technologist may apply a compression band around the body to better visualize the urinary structure leading from the kidney. When the examination is complete, you will be asked to wait until the radiologist determines that all the necessary images have been obtained.
What will the patient experience during and after the procedure? The IVP is usually a relatively comfortable procedure. You will feel a minor sting as the contrast material is injected into your arm through a small needle. Some patients experience a flash of warmth, a mild itching sensation, and a metallic taste in their mouth as it begins to circulate throughout their body. These common side effects usually disappear within a minute or two and are harmless. Rarely, some patients will experience an allergic reaction, itching that persists or is accompanied by hives, can be easily treated with medication. In every rare cases, a patient may become short of breath or experience swelling in the throat or other parts of the body. This can be indication of a more serious reaction to the contrast material that should be treated promptly. Tell the radiologist immediately if you experience these symptoms. During the imaging process, you may be asked to turn from side to side and to hold several different positions to enable the radiologist to capture views from several angles. Near the end of the exam, you may be asked to empty your bladder so that an additional X-ray can be taken of your urinary bladder after it empties. The contrast material used for IVP studies will not discolor your urine or cause any discomfort when you urinate. If you experience such symptoms after your IVP exam, you should let your doctor know immediately. Who interprets the results and how the patients get them? A radiologist, a physician specifically trained to supervise and interpret radiology examination, will analyze the images. A follow-up examination may be necessary so that any change in a known abnormality can be detected over time. Follow-up examinations are sometimes the best way to see if treatment is working or if an abnormality is stable or over time.
What are the benefits versus risks? Benefits. Imaging of urinary tract with IVP is minimally invasive procedure. IVP image produces valuable detailed information to assist physician in diagnosing and treating urinary tract condition from kidney stones to cancer. Follow-up examination are often necessary and your doctor will explain the exact reason when another exam is required. Sometimes, a follow-up exam is done because of a suspicious or questionable finding needs clarification with additional view or a special image technique. A follow-up examination may be necessary so that any change in a known abnormalities can be detected over time. Follow-up examinations are sometimes the best way to see if treatment is work or if an abnormality is stable over time. What are the benefits versus risks? Benefits. An IVP can often provide enough information about kidney stone and urinary tract obstruction to direct treatment with medication and avoid more invasive surgical procedure. No radiation remains in a patient body after an X-ray examination. X-rays usually have no side effect in other diagnostic age. Risk. There is always a slight chance of cancer from excessive exposure to radiation. The effect radiation dose for those procedure varies. Contrast material used in IVP study can cause adverse allergic reaction in some people, sometimes requiring medical treatment. Women should always inform their physician or X-ray technologist if there is any possibility that they are pregnant. A word about minimizing radiation exposure. A special care is taken during X-ray examinations to use the lowest radiation dose possible while producing the best image for evaluation. National and International Radiology Protection Council continually review and updates the technique under standard used by radiology professionals. State-of-the-art X-ray systems have tightly controlled X-ray beams with significant filtration and dose control method in minimizing stray or scattered radiation. This ensures that those parts of the patient body not being imaged receive minimal radiation exposure. Limitations of IVP exams. An IVP shows details of the inside of the urinary tract, including the kidneys, ureter, and bladder. Computed tomography or magnetic resonance imaging may add valuable information about the functioning tissues of the kidney and surrounding structure nearby the kidneys, ureter, and bladder. Small urinary tract tumors and stones are more easily identified on those examinations. IVP exams are not usually indicated for pregnant women. They use for IVP in infants and children are limited. Other tests, including ultrasound, can be used in most cases to evaluate the kidneys. In general, IVPs are not done in pediatric patients. An IVP is done to look for problems with the structure of the urinary tract, find the cause of blood in the urine, find the cause of ongoing back of lung pain, locate and measure a tumor of the urinary tract.